Assalamu alaikum. Welcome to my channel. Today's lecture is based on the topic oral communication. That is the very first unit, BSN Nursing in English portion. So before we talk about the oral communication, we need to know about what actually the communication is. Okay, communication is actually the exchange of information, of ideas, facts, your opinions, your belief and feelings and attitude through any medium that can be verbal or that can be non-verbal. So the exchange of ideas, exchange of your thoughts, any fact, any opinion through any medium, that is called communication. So what is the purpose of communication? Why we need to communicate with each other? Okay, first let me clarify that this is the thing that human being can communicate with each other that makes their rank higher than any other species in this world, just because of their language, just because of the ability that they can communicate with each other. Okay, and the purpose of communication is to establish and maintain a relationship. We need this, okay, to help problem solve, diagnosing and treating clients, to persuade and change attitude or behavior, to develop an understanding of other people. So we need to communicate with each other for these purposes. Okay, and now we talk about the oral communication. It is the ability to express oneself clearly. Oral communication, it is the ability when we use language to communicate, and it can be face to face communication, it can be in the form of a presentation, it can be through any electronic devices, through mobile or laptop or any other medium, and it can be in a meeting or discussion. They are all form of oral communication. Now we talk about the importance of communication. It is very crucial and very important in all to maintain the relationships that can be between husband and wife, that can be between parents and children, between the teacher and a student, between a doctor and a patient, and colleagues, employers and employee, every level of an organization. So we need a better communication setup. Okay, not specifically, we are not talking about in nursing how effective the communication is. It is very important in all fields of life. Now specifically we are talking about the field of nursing. So it is very important for nurses to have a very good ability of communication, because nurses who take the time to listen and understand the concerns of each of their patients, they are better prepared to address issues of the patient and to solve them. On the other hand, the poor communication or lack of communication in healthcare department in nurses lead to misunderstanding or failing to follow the treatment well. So there was a report by Joint Commissions. They said that the 80% of serious medical errors were because of poor communication in healthcare dealing with the patient. Okay, the transferring of data. So 80% of serious medical errors were there just because of lack of communication in nursing. So for nurses, good oral communication means approaching every patient, interacting with every patient, and with the intention to understand the patient concerns. Now come towards the types of communication. There are two main types of communication. The first is verbal communication. So in verbal communication we use the language. Okay, we use language. It is in a spoken form. Okay, it has many subtypes we will talk about later, but the spoken form. So speak with clarity, with accuracy, and honesty as well. I may say that clarity, accuracy and honesty is very important while using a language. So know your audience, speak appropriately according to the person's age whom you are speaking, your culture, and the level of health and literacy of that person to whom you are speaking. Even if you are feeling stressed out or frustrated, be aware of your tone of voice and don't let these emotions leak into your patient's interaction. Though you are stressed, though you are feeling tired, though you are frustrated over something, no, these things are not going to happen. These emotions are not going to leak into your speaking while you are with any patient. So encourage the patient to communicate by asking questions. You can ask question to the patient, and can you please tell me a bit more about it, can you please explain it clearly. So speak in a clear and complete sentences while you are talking to a patient. So avoid any kind of I may say the technical jargon या कोई तंजिया लहजा, तो इन चीज़ों को आपने अवॉइड करना है. That is a verbal communication. In verbal communication you need to know the language, the vocabulary, the denotative and connotative form. The denotative and connotative, they are two. Denotative is the dictionary meaning of a word. Okay, when I say a red rose, so red rose in a dictionary meaning, in a denotative meaning, it is a red flower. And when I connotative meaning, I say red rose, that is the symbol of love and care, desire. So that is the figurative meaning. So you need to know any kind of words, and the rise and fall of your voice while speaking, the clarity, the consciousness, the preciseness, comprehension, the brevity, timing, and relevance of your sentences. That is very important while verbal communication. Subtypes of verbal communication are four. Spoken communication is in there. Verbal communication, that may be in the form of a written communication. You have written something, and that is also a form of verbal communication. Telecommunication and electronic communication while using any laptop or mobile, that is also a verbal communication. Okay, then comes the non-verbal communication. Okay, non-verbal, what is non-verbal communication? Okay, in this type of communication we don't use language, but our facial expressions, our touch, our body movement and posture, our eye contact, our gestures, they tell that you are listening or not, you are interested or not. They are speaking on their own. Okay, I can tell you an example for this, that while there are many guests are over here in my house and my kids are making noise and they are just jumping like monkeys on the sofas, so I just look at them, and my 4-year daughter can also understand that what mom is just saying now. So that look of anger and of the facial expressions of mine just tell them that how they are going to behave after that. So this is the kind of non-verbal communication. घूर के देखना, कह देना, तो वो उससे भी पता चल जाता है कि बात क्या कहना चाहता है अगला बंदा. So this is the kind of non-verbal, in which your body language, in which your gestures, posture, your tone of voice, you are smiling, your smile can tell anything. So in this form, when a nurse is non-verbally communicating with someone, so she need to show interest, she need to nod, she need to nod your head, you need to smile, and you need to lean forward. Just so that is a sign of active listening, that you are listening well. Now we come towards the purpose of communication. Purpose, in when we talk about the purpose of communication, there comes the formal and non-formal communication comes here. A formal communication, when we talk about a formal communication, it follows lines of authority. I'm talking about the healthcare department. Okay, give me just let me give an example. Then if the nursing superintendent is there of the hospital and he or she needs to communicate with the staff nurse, so he or she will definitely first communicate with that staff nurse through assistant nursing superintendent or supervisor or ward in charge. Okay, so this is the line of authority which he she or is following. So that is the formal communication. And in informal communication, it does not follow line of authority. Okay, the examples of this kind of communication are gossips or chit chat or kitty parties that usually take place in social groups like family and friends. They are informal communication. And then comes therapeutic communication. Therapeutic communication takes place between a healthcare personnel and a patient with the purpose of modifying the patient behavior, in which, okay, you are exchanging ideas just to know the patient behavior and the issues with the patient. So this is the kind of therapeutic communication. Then comes the levels of communication. There are more than 3 to 4 or 5 types of level I'll say there. Okay, just let me. The very first is intrapersonal. Intrapersonal level is a self-talk. It is called a self-talks. It take place within the individual. Okay, you are talking to yourself. You are self-wearing yourself in mind. You are stress managing. You are in your mind. You are some kind of decision making is there. Your relationships are there in your mind. So it is a kind of self-talk that is called intrapersonal. Then come interpersonal. Interpersonal communication is when two or more people exchange message or ideas. Okay, you exchange your ideas and message with someone else, or they can be group of people, or they can be one. This is one of the most common form of communication in our daily life, interpersonal. While we staying in home or going outside, we follow this kind of communication, interpersonal. Then come the transpersonal communication. Transpersonal communication is some kind of spiritual communication. It takes place within a person's spiritual domain. Okay, the purpose of this communication is to realize selfhood, enhance your spirituality, and answer questions that are spiritual in nature. Okay, it is that kind of communication. Then comes small group communication. Small group mean when a nurse interact with two or more individual face to face, or using a medium, okay, through a staff meeting or through a patient care conference. That is a small group of communication. Public communication, that is larger in size. Okay, then you are talking to some group of people in a huge number. That can be public communication. Now towards the pattern of communication. Pattern of communication, that can be one-way communication. Okay, one-way communication that takes this one person speaking and the listener is just silent. Okay, just one person is delivering his ideas. That is one way communication. And this occurs, the example of this is the lecture method. Okay, the teacher comes on the stage and he starts writing, or starts writing something, and the others are just listening. So this is the one way communication. When one person is speaking, there is no feedback, there is no questioning, and the receiver has no chance to provide any feedback. That is one way communication. Now comes two-way communication. What is two-way communication? When the listener is also participating in the communication. That is two-way. When both communicator and the audience are part in the process of speaking. Okay, the listener may raise questions. Okay, they can add information on the subject which is being talking about. So this is a very effective two-way. Two-way communication is very effective because of the feedback, because of the response. Then comes the one-to-one communication. One-to-one communication is one-to-one, when one person is going to one person and delivering some idea. Just let me give an example, that a nurse is providing information to a patient is an example of one-to-one. One-to-one. And then comes the one-to-many. Then one person is giving any kind of information to a group of or many people. So example of this is that any nurse is providing healthcare education to a community. In a community there are many women, there are many kids, there are many males as well. So this is one to many. Then comes many to one. In many persons are interacting with just one person. The example of this is taking an interview when a panel is sitting there, 4 to 5 members or board members are there, and the interviewer are just one person, so many to one communication is being taken place there. Process of communication, we will make another video on this topic, process of communication. It is just a structure that a sender is there, sender, the speaker, okay, encoding his message channel, how he is speaking in a form of presentation, in a form face to face, or how he is speaking, the decoding, and the receiver is receiving the information and then comes towards the feedback. So we will make another video on this topic. Let me know if you have found this video informative, and do please share your topic if you want to any clarity on any particular subject or any particular topic. Let me know in comments. Thank you.